Dr. Corey Maas, I'm looking your best. One of the main questions that people ask once we go through the sort of technical parts of doing aesthetic facial surgery or aesthetic plastic surgery in general is, what type of anesthesia do I need to have? And I think there's a very good questions because everybody watches television, they hear all kinds of stories about anesthesia from good to bad. And the bottom line is anesthesia has come a very long way, even in the last 10 years. And we have lots of options available that are suitable to any of a different variety of conditions and patient conditions, whether the surgeries we choose are smaller or the patients that we have are super sensitive. We can manage them with a variety or a menu of different surgical options. In general, while the anesthesia can be divided in a number of different ways, at the San Francisco Rejuvenation Center and the Maas Clinic, we like to think of anesthesia in a couple of formats. One of them is local anesthesia, where you're simply doing a very small procedure and we give injections of numbing to treat the area. And more commonly, it's local with sedation. And when we're doing local with sedation, that can simply be a couple of pills that you're taking based on your needs, or it could be a little IV is started. Well, we certainly do monitoring whenever we're doing sedation, and there are very strict guidelines for how we do that are set up. But local with sedation allows you to really relax and feel very comfortable from the medicines themselves. And then we are able to really do the local injections without much of any even remembrance of the procedure itself. The second general type of anesthesia, and I say general, it's not general anesthesia from our definition, is what we call monitored deep sleep anesthesia, or MDSA. MDSA anesthesia is a very nice hybrid between being sedated, if you will, with local and sedation, and having what is traditionally called general anesthesia, where you're all the way out, you're paralyzed, you're on a respirator, and you're really completely under the influence of the anesthesiologist and the machines that are breathing for you. We don't have to do that with this type of surgery. For most of our patients, we can do monitored deep sleep anesthesia, and the procedure is as follows. The patient will come in and get a little IV, they'll be sleepy and brought into the operating room. We, with that IV, are able to get them very nicely sedated. We'll use some protection of the airway with a newer device called an LMA. It's not down in the trachea, but it protects the airway from secretions dropping down, so there's no problem with aspiration with this. And the patient is allowed to totally breathe on their own. So there's no paralysis, so they can get a tube down through the vocal cords. You don't have to be on a respirator, you're breathing on your own, and we just keep you very comfortable during the procedure with MDSA by keeping you in a nice level, even layer of sleep. I numb people up as though they're awake anyway. The brain registers no pain or discomfort, so that makes it very nice. And when they turn the medicine on, you go to sleep, they turn it off, you wake up, and it's very, very simple procedure without all the nausea or hangover effects that is traditionally associated with the general anesthesia as most people think of it. So again, just a summary, the basic categories are local and local with sedation, and then what we call monitored deep sleep anesthesia. For the body surgery, there may be some need to do general, and there's some very nice ways to do general anesthesia where they have it comfortable for our patients. But for the most part, with the aesthetic facial surgery that I'm doing, we have very low narcotic needs, and thus people are not sick afterward, and very low anesthesia needs, frankly, because I numb people up as though they're awake, and that makes it comfortable and easy for patients. So if you have any questions about anesthesia types or choices, please feel free to write on the blog at drmaas.com. You can call the office or send us an email, and we're very happy to respond and get those cleared up. And again, very, very appreciative for you following us on drmaas.com. Follow me on Twitter, twitter.com/Dr. Corey Maas, and facebook.com, the Maas Clinic at Maas Clinic. So Dr. Corey Maas again, signing out. Thanks again.